Hey lovelies, how are you? I hope your day is coming along well. Welcome to my YouTube channel. I'm really excited and delighted and happy to have you on board. Today I want to talk about an ectopic pregnancy. What is it? What could put you at risk of getting one? What will show you have an ectopic pregnancy? Basically the presentation and the investigations that can be done. How is it treated or managed? The other thing is, what can we do to prevent a recurrence of the same? And then the final thing is, in a case where you have had an ectopic pregnancy and both your tubes have been affected, is there a way forward for you? Is there hope for you? Now, allow me to start with the definition of an ectopic pregnancy. But before I do this, it's important for us to understand the process through which we finally have a baby. So you have your ovaries, which release a mature egg, and then you have a sperm that's going to mate with the ovum through the process of fertilization to form an embryo. This embryo has to travel towards your uterus to grow, and finally at the end of 9 months, or the months that God allows the baby to be in the womb, we have a kicking baby boy or baby girl. Now, in the event of an ectopic pregnancy, this embryo that has been formed from fertilization fails to actually move to the uterus and grow from there or implant from there, but you find it moving towards other places. The most common place is the fallopian tube. That is the most common place. More than 70% of ectopic pregnancies will be in the fallopian tube. But you can also find an ectopic pregnancy in other parts of your body. You can find a pregnancy in your abdomen, in your ovaries, at the cervix, basically a place that is not the uterus. Now, what are some of the things that could put you at risk of getting an ectopic pregnancy? The first thing is pelvic inflammatory disease. Those are just basically infections affecting your pelvic organs or affecting your reproductive organs as a woman. And mostly how you end up getting this is many people have repeated sexually transmitted infections that are not treated, and then the infections ascend and finally involve most of your pelvic organs. You could find the infection involving your fallopian tube. You end up with what we call salpingitis. That is the second thing that could put you at risk, is that if you have a previous history of an ectopic pregnancy. The third thing is if you have a history of use of a coil, that is, you have a coil in situ. We refer to them as intrauterine contraceptive devices. The fourth thing is that those who've had a previous history of surgery, let's say mostly we have women who unfortunately have blocked tubes, and so a surgery is done to try and open the tubes. In patients who are known to be smokers, an association has been found between smoking and ectopic pregnancy, though the percentage is not a very significant percentage. We also have cases of use of assisted reproductive technologies that could put you at risk of actually getting an ectopic pregnancy. And unfortunately, in patients who've had a history of spontaneous abortions, more than 3 cases or more than 3 episodes of spontaneous abortions, that's also a risk factor. And in patients whom procedures have been done to try and terminate pregnancies, that can also put you at risk of getting an ectopic pregnancy. Now, how will you know you have an ectopic pregnancy? The only way to know is by the symptoms that you'll present with and investigations that will be done. There are 3 common symptoms that are present in up to 50% of patients with ectopic pregnancy. But it's not necessarily that one will have all these 3 symptoms for us to say that you have an ectopic pregnancy. So the first and common one is that you have a period where you don't have your menses, what we refer to as amenorrhea. You could realize you've missed your menses, maybe the first month, no menses, the second month, no menses. That could be one symptom. And then the second thing is abdominal pain, and this pain could be generalized, could involve your whole abdomen, or at times could be localized depending on where the ectopic is. Let's say the ectopic is has affected your right tube, then you could find this pain localizing on the right abdominal region, or if it's on the left abdominal region. And then the third thing, at times patients have a history of abnormal vaginal bleeding. Now, it's common that you'll have these symptoms. You might decide to go to hospital because either you could be pregnant, or you could ask yourself, why am I having such menses? Why are these menses this painful this time round? Because some women have actually thought that the bleeding is their menstrual period, only to come realize later that they're having an ectopic pregnancy. So when you go to a hospital, one thing we will do is to do a pregnancy test. In an ectopic pregnancy, the pregnancy test will turn positive, and then we'll have to do an ultrasound to check your womb, to check where is the issue, because it's not automatic that if you have these symptoms and the pregnancy test is positive, then you actually have an ectopic pregnancy. No. Now, when you do an ultrasound, you'll find that the baby is not growing in the womb, but in the fallopian tube, or in another place that is not the womb. So an ultrasound will help us confirm that indeed you have an ectopic pregnancy. Now, once we confirm that you have an ectopic pregnancy, what do we do as healthcare practitioners? There are two things we can do, and that depends on you as a person, on the clinical assessment of the person. So there are patients who come in with ectopic pregnancy, and unfortunately, why this is an emergency is because it's growing. Let's say it's growing in the tube. So as the baby keeps growing, the tube is not sufficient to accommodate the baby. So you find the tube rupturing and you bleed. You can actually bleed to death. So there are patients who come in with what we call a ruptured ectopic pregnancy, and they are not stable. The blood pressures are very low. They have really bled. They are white. This is an emergency. These are patients whom we take directly to theater. The only way of sorting out these patients will be taking them to theater and sorting out the ectopic. But then you have patients who have an ectopic that is still small, it's not ruptured, they're hemodynamically stable. There's also an option of doing medical treatment using a drug we refer to as methotrexate. But in many cases, the best way forward is going to be to take you to theater. Then we find the affected tube. And what we do is, you can do two things. You can do either a salpingostomy, where we just remove the ectopic, but majorly what I have seen, you do a salpingectomy. So you're going to incise and remove the affected tube. Where the ectopic is, you remove that part of the tube together with the affected tube. So you realize that at the end of the day, when this procedure is done, one of your tube becomes non-functional because a good part of it has been removed, and you remain with the other tube. That is what happens. Now, following an ectopic pregnancy, what are some of the things which you can do to avoid recurrence? The first thing will be, after an ectopic pregnancy surgery, I would really advise that take some time before getting pregnant to allow for healing to take place. You can take at least 6 months, be on family planning, and let healing take place. That's what I would actually advise. And then the other thing is, I've talked about the things that could put you at risk. If you're a woman, if you're a man, and you people are in a sexually active relationship, please be faithful to each other so that we can prevent cases of sexually transmitted infections and things which could put you at risk of getting pelvic inflammatory diseases. Or if what the person you are with is not your sexual partner, remember to use a condom, use protection. That is very important. And then the other thing is, there are things we won't have control over. For instance, if surgery was done and it had to be done, we really don't have control over that. But for the few things that we can control, then that's very important that we do so. A coil, as I have said, could put you at risk, but the percentage is very low. And that's why it's important. If you have a coil, you need to do checkups. Immediately a coil is put, you have to go for checkup after 1 month, after 6 months, you have to do regular checkups. Yeah, as a person, as a woman, you know there's a way in which you can feel the strings of the coil. If you can't feel them, then go to hospital so that you're not at risk. Because what happens is at times the coil gets displaced and then you get pregnant. There's no way the embryo can move to the uterus because the coil is there, and so you end up with an ectopic pregnancy. In the event that unfortunately you've had an ectopic pregnancy and both your tubes have been taken out, is there hope for you? Yes, there is still hope for you, and you don't need to give up. You don't need to give up because your ovaries are still functional. They're producing ovum. Your husband is still functional and he has sperms. So you can do assisted methods of reproduction such as in vitro fertilization, whereby your egg and the sperm are fertilized in a good place in the laboratory, and then the resulting embryo is allowed to grow in your womb. So if you've had such cases of ectopic pregnancies, please don't give up. Don't give up. There's still hope for you. And I wish you the very best. If you have any questions, you're free to ask. Thank you so much. If you haven't subscribed to this channel, please do so. I have been your host, Dr. Victoria. Thanks, guys, and I love you.